My name is Victoria Bevis, and I'm a new pediatrician here in the community, and I'm joining the Pediatric Associates of Auburn. I treat children that's birth through 21 years of age. We do sick and well child visits at our clinic. So that means that if you are just needing a checkup and a school physical to get on a sports team, or your child has an earache or a sore throat or a hangnail that needs to be fixed, I'm your girl. I can help you out.
My name is Bentum, and I practice with East Alabama Maternal Fetal Medicine. A lot of people don't know what maternal fetal medicine is, and it is essentially the care of a high-risk pregnancy, and a pregnancy can be high risk for a variety of different reasons. One of the things I noticed when I left Auburn and was in surrounding areas was the amount of time that people had to travel in order to receive services. And one of the things I wanted to help with is providing good care close to home where people can conveniently access excellent care. And so that brought me back to this community. This community has given a lot to me in terms of education and a great place to grow up, and so it's fun to be back in the community and give back in the small way.
My name is Kerri Bevis. I am a gynecologic oncologist. The amount of time that I've practiced this specialty in training and then as a practicing physician, I have seen the transition from a situation where the only opportunity to really get GYN oncology care in the entire state was in Birmingham. The thing that excites me the most is that now as this area grows, I'm able to bring those services and that level of care to the patients where they are, instead of having them travel hours upon hours to get the care that they need for the cancer that they have.
My name is Mark Burroughs. I'm an emergency medicine physician. I was fortunate enough to do some training here in medical school and was just inspired by the community and really learned a lot and felt accepted. And so I was jumped at the chance to be able to come back, and hopefully I can serve them as much as they were able to help me out. I'm excited to have the opportunity to give back. And I think East Alabama Medical Center is viewed as a pillar of the community, and just would like to do my part in serving them.
My name is Luke Ellenburg, and my specialty is urology, and I'll be practicing with Urology Associates of East Alabama. When I was looking for jobs after residency, I was really drawn to the community here, the quality of the hospital here, and the high quality of the urology group that's already practicing here.
I'm Laura Hughes, and I'm a rheumatologist. In rheumatology, we provide care for autoimmune diseases, so diseases such as lupus, rheumatoid arthritis, myositis, more autoantibody mediated diseases, and then we care for more common diseases like osteoarthritis in the knees, and we care for arthritis caused by different causes such as gout or chondrocalcinosis. So it's a broad spectrum of diseases that we treat, autoimmunity and also some degenerative changes.
My name is Avery Lisenbe. I'm an emergency medicine physician. The majority of our patients are in their darkest hours. They're sick and scared and don't know what's going to happen, and it's really rewarding to be able to take care of them during that time.
I'm Dr. Cynthia Lorino. My specialty is I'm a diagnostic radiologist with breast imaging specialty, and I will be practicing at the Breast Health Center. I'm most excited to bring something new to this area that is needed for the women We want to be here for the women. We want to make things as easy as possible for them, as well as the referring physicians. They can come one place, get their mammogram, get the ultrasound, get their biopsy if they need it, get breast MR if they need it. And then we're going to provide a whole new level of care once a diagnosis is made so that we can make the journey for that patient as easy as possible.
My name is Gaeton, Lorino. My specialty is pulmonary medicine, and I practice here in the outpatient clinic. I think this area is dynamic. You can see it growing all around you. And I think that the direction that this facility has taken in the last few years, I think is admirable. I'm glad to be here and be part of it.
My name is John Mahram. I'm an OBGYN and I'm practicing at Lee Obstetrics and Gynecology. I went to a large university setting for training, and I really spent a lot of time and got fantastic training. But in a large university setting, you don't get to build those relationships, and really you just take care of people and they move on, and you're just constantly busy. I'm really excited for the opportunity to build relationships with my patients and really take care of my neighbors in a small community.
My name is Brad Peden. I'll be practicing cardiology with Pinnacle Cardiovascular Associates in Opelika Valley. So I chose to practice medicine because it's a very fascinating field, it's challenging, and you have the opportunity to care for patients. But secondly, and more importantly, I feel like medicine's a calling, and it's a calling that I felt at a very early age. It's a way that I feel like you can reciprocate and show God's love to those around you that He's shown us first.
My name is Leah Sanchez, and I practice with the Neurology Center of East Alabama, which is part of the East Alabama Health System. Pediatric neurology is different than adult neurology because, first of all, kids are not little adults. Any pediatrician will tell you that. The brain is evolving and developing, and so there are changes that happen along the way that you have to adjust for. So it is very interesting and dynamic in that regard.
My name is Chelsea Zimmerman. My specialty is pediatric endocrinology, and I'll be practicing at endocrinology and metabolism with East Alabama. I was diagnosed with type 1 diabetes when I was 16 and a junior in high school, and I decided after my first appointment with my pediatric endocrinologist that this was for sure what I wanted to do. And then that was really confirmed when I sought out different opportunities through college and medical school to shadow and work at camps for children with diabetes, and I've really grown to love this field.